Good evening. President Biden today saying the new variant is a cause for concern, not for panic. And local health officials are echoing those sentiments, saying there's still a lot we need to learn about this new variant. A new COVID-19 variant of concern, the Omicron variant, is gaining traction globally. It was first found in Botswana and then appeared to spread rapidly through South Africa. Now it's detected in more than a dozen countries, including Canada.
We know that variants are going to arise, and the most important thing is to identify them, understand them, and then have a plan.
Dr. Anne Ramoyne, a UCLA professor of epidemiology, says there are three potential areas of concern with the Omicron variant. First, is it more transmissible?
It does appear that it may be more transmissible, but this is still anecdotal evidence.
Second, does Omicron cause more severe illness?
One province in South Africa where they've seen several cases of this variant, they're starting to see increases in hospitalization, and so it could be an indicator, but it's still too early to say definitively.
And third, can Omicron evade vaccine protection? The answer is still unknown, but
it appears that this variant can also increase the probability of reinfection for people who've had COVID before, and could potentially also jeopardize the immunity that we have from our vaccines.
International doctors report the majority of patients are in their 20s and 30s with mild symptoms. Moderna and Pfizer are already working on vaccines to specifically target the Omicron strain. But doctors say there's little risk of hospitalization or death for fully vaccinated people.
Get your vaccine, get boosted.
The CDC Monday updating their recommendation, saying everyone 18 and older should get the booster shot. Dr. Drew, appearing on the Fox 11 special report, weighed in.
Thus far, people are saying, the vaccine community is saying, that a fully boosted patient is in high probability of being in very good shape against this particular variant.
The White House plan of action is vaccines, boosters, and a new travel ban to and from 8 South African countries. But experts say the reality is Omicron is probably already in the U.S.
We should anticipate that it's already here. These travel bans are only going to be effective on the margins. They may slow down the spread of this variant, but they're not going to keep it out of the country.
And Dr. Ramoyne says the U.S. is already anticipating a potential COVID surge because of the winter months, the holidays, and increase in travel. And whether or not the new COVID variant will contribute to that is unknown at this time. Reporting live this evening, I'm Koco McAboy, Fox 11 News.